Bismillahirrahmanirrahim. Today my topic of presentation is diabetes mellitus, and my name is Dr. Fansa Junaid, and I am presenting this presentation under kind supervision of Professor Dr. Saira Afsar. Never underestimate a good deed. There is no deed too small for Allah to accept. World Diabetes Day celebrated on 14 November. Learning objectives of today's presentation is introduction, classification of diabetes, type 1 and type 2 diabetes, metabolic syndrome, epidemiology, screening, management, prevention, recent advances, and MCQs. Learning outcome. By the end of this presentation, participants will be able to describe the introduction, classification of diabetes, type 1 and type 2 diabetes, metabolic syndrome, epidemiology, screening, management, prevention, and recent advances and MCQs. Introduction. Diabetes is a chronic metabolic disease characterized by elevated level of blood glucose which leads over time to serious damage to the heart, blood vessels, eyes, kidneys and nerves. Diabetes is actually an epidemic in developing as well as developed country. It is a chronic metabolic disorder of multiple etiology because of defects in insulin secretion or action. Classification of diabetes. Type 1 diabetes is actually due to beta cell destruction, usually lead to absolute insulin deficiency. Type 2 is insulin resistance with insulin secretion deficiency. 90 to 95% of people who have diabetes have type 2 diabetes. Other types of diabetes include due to genetic defects in beta cell function, genetic defects in insulin action, exocrine pancreas disease, endocrinopathies, drug or chemical induced infections, or other rare forms. Gestational is actually the diabetes in pregnancy. It includes insulin resistance with beta cell dysfunction. Metabolic syndrome. It is actually exists with diabetes. It is disease syndrome X in which there is the diabetes, stroke, and heart disease. There is abdominal obesity. There is waist increase in man, and in female. Female BMI is more than 25 kilogram per meter square, and there is hyperglycemia. Fasting blood glucose level is more than 110, and and patient is on diabetic medicine, and there is also high lipid profile. Triglyceride is more than 150 milligram per deciliter, and there is HDL is less than 40, and 40 in male and 35 in female, and there is also hypertension, and the systolic blood pressure is more than 140 to 50 millimeter mercury, and these three hypertension, lipids, hyperglycemia, and abdominal symptoms leads to metabolic syndrome in which the diabetes is predominant. The diabetes mellitus is actually as a part of metabolic syndrome. Type 2 diabetes and cardiovascular share a common history. The concept metabolic syndrome. There is heart disease, lipid problems, hypertension, type 2 diabetes, and there is clustering of central obesity with several of major cardiovascular disease risk factors. Type 1 diabetes symptom. It is actually unseen in under less than 30 years of age. Reason is past viral infection or genetic predisposition. And the symptom of type 1 diabetes is excessive thirst, frequent urination, weight loss, blurred vision, or fatigue. And there is destruction in beta cell of pancreas. Sign and symptoms of type 2 diabetes. In type 2 diabetes, there is strong family history of diabetes, tingling and numbness in the feet, leg cramps and numerous falls, blurred vision, obesity, increased thirst, itching, feeling tired all the time, mental confusion, feeling dizzy, and mood swings. As type 1 and type 2 diabetes, in type 1 diabetes, there is cannot be prevented or cured. The body does not create enough insulin. Causes are unknown, but genetic may play a role, and it requires insulin injection for life. Type 2 diabetes can be prevented through lifestyle modification. The body does not create enough insulin or develop insulin resistance. Causes include genetics, aging, inactivity, obesity, and more. Requires insulin as needed injection or oral. In both, it can cause serious health problem and combination. Their complications require a healthy lifestyle and medical supervision, include thirst, frequent urination, and blurred vision. Gestational diabetes and sign and symptom. Gestational diabetes is actually the diabetes which is in pregnancy. Its sign and symptom include constant thirst, constant hunger, and constant urge to urinate. In gestational diabetes, you consult with gynecologist, healthy low sugar diet, staying active and exercise, and losing extra weight. Gestational diabetes is actually a condition in which women without previously diagnosed diabetes exhibit high blood sugar level during pregnancy, and this high blood sugar level in mother brings extra glucose to baby and causes baby to put on extra weight. Epidemiology of diabetes. Burden of diabetes. According to World Health Organization globally, the number of people with diabetes rose from 108 million in 1920 to 42 million in 2014, and prevalence has been rising more rapidly in low and middle income countries than in high income countries. Between 2000 to 2016, there was 5% increase in premature mortality from diabetes, and in 2019, diabetes was ninth leading cause of death, with estimated 1.5 million deaths directly caused by diabetes. In 2015, according to WHO, 8.5% of adults aged 18 years and older had diabetes. And in 2019, diabetes was direct cause of 1.5 million deaths, and 48 of all cause of deaths due to diabetes occurred before the age of 70 years. Between 2000 to 2016, there was 5% increase in premature death before the age of 70 from diabetes. And in high income countries, the premature mortality due to diabetes decreased from 2000 to 2010, but increased in 2010 to 2016 in lower middle income countries. The premature mortality due to diabetes increased both periods. Latest in Pakistan, latest figure which is shown in World Diabetes Day in Pakistan released back in 2019 that 19 million people now living with diabetes in Pakistan as the number continues to rise, and 17.1% of adult people population in Pakistan now living with diabetes. Some epidemiological factors which in insulin dependent type 2 diabetes, which is actually type 1 diabetes host factor, in it is mostly seen in age less than 30 years. Type 1 and type 2 diabetes is usually seen in the adults more than 30 years. Environment is sedentary lifestyle, and non-insulin dependent diabetes mellitus is actually seen in both gender, and it is due to the HLA, DR3, D4, gestational diabetes, and obesity. Whereas the environmental factor which play an important role is low dietary fibers, malnutrition, alcohol, stress, viral infection, beta cell destruction. Um, Etiology of type 1. It is due to autoimmune disease, selective destruction of beta cell by T cell, several circulating antibodies against beta cell. Cause of autoimmune attack is unknown. Both genetic and environmental factors are important. Type 2 diabetes response to insulin is decreased. Here is decreased glucose uptake in muscle and fat, decreased glucose production in liver. The mechanism of insulin resistance is unclear. Both genetic and environmental factors play a most important role, and there is post-insulin receptor defect. Comparison of type 1 and type 2. Type 1 diabetes is sudden onset, whereas type 2 is gradual onset. Type 1 can occur at any age, but mostly young age less than 30, and it is occur in mostly in adults more than 30 years. Body habits. Habitus type 1 people is usually thin or normal. Type 2 is often obese. Ketoacidosis is common in type 1 diabetes, where it is rare in type 2. Autoantibodies is type 1 is usually present, in type 2 it is absent. Endogenous insulin is low or absent, in type 2 it is normal, decreased or increased. Concordance in identical twins, in type 1 it is 50%, in type 2 it is 90%. Prevalence, it is less prevalent, and 90 to 95% prevalent is type 2 diabetes. This factor for type 2 diabetes is actually age more than 30 years, gender. Genetic factor is HLA at DR3 and DR4. Genetic factor defective immune response, central obesity. Environmental factors play a most important role in type 2, include environmental factors, sedentary lifestyle, high saturated fat intake, malnutrition, excessive alcohol, viral infection, mostly mumps and rubella, chemical agent, alloxan, cyanide, streptozone, or environmental stress. Dietary factors include characteristics of food intake, dairy products, glycemic load, Western diet, fast food intake, soda intake, alcohol intake. Complication of diabetes. Short-term effects of diabetes include ketoacidosis. There is recurrent or persistent infection include tuberculosis, infection of skin, ear, nose, throat, mouth, stomach infection, fruity smell, dry mouth, and sleep. Both hyperglycemia and hypoglycemia coma in short-term complication of diabetes in long-term effects of diabetes, which include microvascular effect and macrovascular effect. In brain, it can cause stroke. Visual impairment include diabetic retinopathy, cataract, and glaucoma. Kidney disease, heart disease, bacterial and fungal infection of the skin, atherosclerosis, sexual dysfunction, autonomic neuropathy, peripheral vascular disease, gangrene, peripheral neuropathy, and ulceration. Continuum of cardiovascular disease is in complication of diabetes. Insulin resistance, for example, hyperinsulinemia, triglyceride, HDL level low, atherosclerosis, and hypertension. And genetic susceptibility, environmental factors in nutrition, obesity, and physical inactivity. It can both responsible for diabetes onset. Then ongoing hyperglycemia in diabetes cause atherosclerosis, hyperglycemia, and hypertension. The passage of time from these complications, there is development of the complication after 10, 15 to 20 years, retinopathy, nephropathy, and neuropathy. It can lead to disability, which include blindness, renal failure, chronic heart disease, amputation, and least death. Screening of diabetes. First, for screening urine examination, urine test for glucose 2 hours after meal is usually used. All these with glycosuria patient are considered diabetic unless proven by standard oral glucose tolerance test. Glycosuria is present in most severe cases of diabetes mostly. The urine examination test has low sensitivity and test varies from 10 to 15% and test result in misdiabetics patient and it results in more false negative and if it is only diagnostic test it is performed in population. Therefore, urine examination test is not considered an appropriate tool for case finding epidemiological survey because of its less sensitivity, which is varies from 10 to 50%. Blood sugar testing. Standard oral glucose tolerance test is cornerstone of diabetes diagnosis. Screening program mostly use fasting, postprandial, and random blood glucose sample. In epidemiological surveys, random blood glucose level is considered unsatisfactory. Therefore, recommendation for epidemiological survey is 2 hour value after 17-gram oral glucose tolerance test alone with fasting value in combination. Now, diagnosis of pre-diabetes and diabetes. There are following tests: fasting, plasma glucose, oral glucose tolerance test, and random glucose plasma level with symptom. In fasting blood glucose level, blood glucose is measured after at least 8 hours of fast. In normal value, it is less than 110 milligram deciliter. Oral glucose tolerance test is in this 75-gram glucose load is ingested after at least an 8-hour fast. Blood glucose level is measured at 2 hours and its level is less than 140 milligram per deciliter or 7.8 millimole per liter in normal patient. Random blood glucose level is blood glucose is measured at any time regardless of eating. Now, in patient with pre-diabetes or diabetes, in pre-diabetes fasting level is 110 or 125 milligram per deciliter, and in diabetes, its level is 126 milligram per deciliter. In oral glucose tolerance test, the in pre-diabetes, its level is 140 to 199 milligram per deciliter, and in diabetes mellitus, its value is more than 200 milligram per deciliter. Random plasma glucose with symptoms include diabetes, more than 200 milligram per deciliter with symptoms. HbA1c glycated hemoglobin level is also used, which is percentage of hemoglobin A to which glucose is attached is also used to assess the glucose concentration. Its normal value is less than 5.7% and in pre-diabetic it is 5.7 to 6.4% and in diabetic it is more than 6.5%. Investigation during follow-up should be urine sugar which is 2 rpp once a week, blood sugar fasting level once in 3 to 6 months, Lipid profile once a year, ECG once a year, urine albumin, blood urea, serum creatinine, retinoscopy once a year, glycated hemoglobin is recommended once in 3 to 6 months. Target population for diabetes screening. It includes age groups to 40 years and above, family history of diabetes, obesity, women with body weight more than 4.5 kilogram, women with excess weight gained during pregnancy, patient with premature atherosclerosis. Management of diabetes mellitus. Treatment of diabetes include diet, lifestyle modification, oral hypoglycemic agents, or insulin. Diet in diabetes. Calories from diet should be managed. Include at least 50% come from carbohydrate, 30% from fat, and 15% from protein. There should be calorie calculation in overweight, normal weight, sedentary lifestyle, heavy worker. And they should avoid sweets, avoid overeating, avoid fasting, and avoid alcohol. Lifestyle modification include regular exercise, walking, aerobic exercises, maintenance of weight, stop smoking, or foot care. Oral, if satisfactory control is not possible with diet and lifestyle changes, then there should add oral anti-diabetic drugs, which include sulfonylureas, tolbutamide, bigonides, metformin, alpha-glucosidase inhibitor, acarbose, thiazolidine, dinodiones, which is rosiglitazone or pioglitazone. There should also be insulin which are used of different varieties, different species, for example, bovine or human recombinant, different preparations, soluble insulin, plain insulin, rapid acting insulin, dispro aspart, prolonged acting insulin, which is isophane, zinc insulin, or glargine. Prevention and care. Level of prevention in type 2 diabetes include primary, secondary, and tertiary. Primary include activities aimed at preventing diabetes from occurring in susceptible population. Secondary is early diagnosis and effective control of diabetes in order to delay the progress of disease. Tertiary prevent complication and disability due to diabetes. Primary prevention. The scope for primary prevention of type 1 diabetes is limited and it is majorly for type 2 diabetes. It includes two types of strategies used, population strategy or high risk strategy. Population strategy is include primordial prevention, means prevention of emergence of risk factor. Maintain body weight through adoption of healthy nutritional habits and physical exercise. High risk strategy include sedentary lifestyle, obesity, avoid alcohol, smoking, high blood pressure, elevated cholesterol, and triglyceride level. Secondary prevention. There should be early diagnosis or treatment if diabetes 12. Maintain blood glucose level. Maintain ideal weight. There should be blood pressure measurement. Routine blood glucose monitoring. Urine for ketones and protein. And glycated hemoglobin estimation should be done 6 monthly or 3 monthly, and it should be less than 6%. Keep sugar in your pocket. Weight, blood pressure measurement, visual acuity, feet care. There should be self care. Adhere to diet, drugs, exercise, investigation, periodic checkup, recognition of symptoms of hypoglycemia, identification card with treatment details. The food care is important um, in the diabetes, and there should be should be washed feet every day with lukewarm water. Dry feet with well, especially between the toes. Moisturize your feet, but not between the toes. Check your feet for blistering cuts or any sore. Keep your toenails at a reasonable length. Wear clean socks that are not too big or too small. Keep your feet warm and dry. Never walk barefoot. Examine your shoe for things that might hurt. Tertiary prevention, strict metabolic control, education, and effective treatment, screening for complication in their early stage when intervention is more effective, screening for eye problems, screening for diabetic retinopathy when there is no, which is cost effective, there is no access to laser treatment, good metabolic control aimed at delaying the progress of diabetic eye disease, management of food problem. A number of intervention has been used: education, pressure, living intervention, multidisciplinary clinics. Screening for renal problem, renal failure in diabetes can be detected very early. Screening for microalbuminuria, effective treatment must be available. Classic levels in the public health response to diabetes, clinical services, glycemic control, BP control, lipid management, annual eye examination, food care, kidney disease testing, flu immunization, preconception care, diabetes education, case management, and targeted screening. Promotion of behavior include education and awareness of physical activity, reduce tobacco, healthy diet, regular doctor visits, self-monitoring, and self-management education. Population target policies include healthcare access legislation, drug and supply reimbursement policies, population registry, and feedback system. Recent advances. Actually, currently there are three organizations which addresses diabetes in Pakistan. In 2019, Pakistan ranked sixth globally for prevalence of diabetes, and there is recent increase in prevalence of diabetes in Pakistan, which is associated with lifestyle changes. One is Diabetic Institute of Pakistan, which was founded in 1996, and it is leading organization in diabetes management, treatment, and counseling in Pakistan in the country. Another organization is World Diabetes Foundation Project, which was started in the to make diabetes treatment more widely accessible, especially focused on low income individual and areas. Between 2015 to 2018, this World Diabetes Foundation project trained more than 300 nurses, doctors, and paramedics in proper prevention. And third is the Diabetic Center, which is a non-profit organization in Islamabad. It aims to improve access to diagnostic screening treatment for diabetes in Pakistan. The organization has 12 clinics that respond to specific complications of disease such as kidney, cardiac, and eye care facilities. WHO response according to diabetes. WHO aims to stimulate and support the adoption of effective measures for surveillance, prevention, and control of diabetes and its complications. It provides scientific guidelines for prevention of major non-communicable disease, including diabetes, develop norms and standards for diabetes diagnosis and care, build awareness on global epidemic of diabetes, making World Diabetes Day marking 14 November, conduct surveillance of diabetes and its risk factors. The WHO Global Report on Diabetes provides an overview of diabetes burden intervention available to prevent and manage diabetes. The WHO issued an module on diabetes and management of diabetes type 2, brings together guidance on diagnosis, classification, and management of type 2 diabetes in one document. In April 2021, WHO launched the Global Diabetes Compact, a global initiative aiming for sustained improvement in diabetes prevention and care, with a particular focus on supporting low and middle income countries. The compact is bringing together national government, UN organization, non-government organization, private sector entities, academic institution, and philanthropist foundation, people living with diabetes, and international donor to work on shared vision of reducing the risk of diabetes. An article is published in JPMA, which assess the knowledge, attitude, and practice of Pakistan population about risk factor causes, complication management. This was cross-sectional study which is conducted in Government College University, Faisalabad from 2017 to 18, randomly recruited from different cities of Punjab. It used pre-designed questions regarding social demographic characteristics, general knowledge about diabetes, perception regarding indication, risk factor diagnosis. Results of study show that 2000 subject 972 had family history of diabetes, 66 per living in urban areas, and 53 per university graduates, and 40% were employed, and 57 belonged to socioeconomic balanced families. Composite knowledge score was significantly associated with age, socioeconomic status. A high significant association was observed regarding family history, level of education, occupation with composite knowledge score. And the results showed that the knowledge level about diabetes was seen to be average. Diabetes in Pakistan, a recent systematic review meta-analysis. The aim of this was to assess the time trend of prevalence of diabetes, pre-diabetes, and diabetes and risk factors associated diabetes in Pakistan. Literature was searched for MBS PubMed Cochrane Library from January 1, 1995 to August 30, 2018 by following the PRISMA guideline. The result of study shows that 635 studies, only 14 studies were considered for meta-analysis, and the prevalence of diabetes in Pakistan was revealed 14% based on 49,418 people using inverse variance random effect model. The prevalence of pre-diabetes was 11%. The risk factors associated with diabetes were found in this systematic review was mean age, proportion of participants with family history of diabetes, hypertension, weight, BMI, and according to this meta-analysis, there was continued increase in prevalence of pre-diabetes and diabetes in Pakistan. All parts of country have been affected, with the highest in Sindh and lowest in Khyber Pakhtunkhwa. Recently, in COVID-19 diabetes is also reported, and there is interrelation and risk factor for severe course in COVID-19. And the relationship between COVID-19 and diabetes mellitus is complicated and bidirectional. On the one hand, diabetes is considered one of the most important risk factors for severe course of COVID-19. Several factors are often present in diabetes mellitus are likely to contribute to this risk, such as older age, pro-inflammatory and hypercoagulable state, hyperglycemia, underlying comorbidities, hypertension, CVD, chronic kidney disease, and obesity. On the other hand, severe COVID-19 infection is treated and steroid can have significant negative impact on diabetes. It leads to worsening of hyperglycemia through insulin resistance and reduced beta cell secretion. Worsening hyperglycemia can in turn adversely affect the course of COVID-19. Although more knowledge gradually surfaces as pandemic progress, challenging in understanding the relationship between COVID-19 and diabetic remain. Now time for MCQs. MCQs 1. A 25 years old female presented in outpatient department with symptoms of extreme thirst, increased hunger, especially after eating, dry mouth, frequent urination, and unexplained weight loss from last 2 months. She reported prior history of diabetes and diagnosis 1 year ago, managed with diet control. She reported fasting glucose in 150 to 230 milligram per deciliter, range most days. She checked her blood glucose before breakfast occasionally and reports glucose usually over 200. Most likely cause of these symptoms are due to gestational diabetes, malnutrition, steroid-induced diabetes, type 1 diabetes, and type 2 diabetes.
D.
B is the delta is a correct answer. Type 1 diabetes, as you can see from the age 25 years female presented in outpatient department, and female it is young, and there is symptom of increased thirst and after thirst and hunger after eating and urination. And fasting blood glucose is 152,230, which is mostly seen in the type 1 diabetes. Therefore, the type of diabetes in which is presented with type 1 diabetes. MCQs 2. Mr. Akbar is 58 years old gentleman with a family history of diabetes. He has a background of ischemic heart disease, mixed hyperlipidemia, and hypertension. He had delayed presentation of inferior myocardial infarction 3 months ago. His most recent lab showed fasting glucose 120 mg per deciliter, HbA1c 6.0%. He has dash type of diabetes.
Beta. B.
Beta, yes, a correct answer is beta, pre-diabetes, because as she has family history of diabetes and fasting blood glucose is 120 milligram per deciliter and HbA1c is 6.0%, which is seen in pre-diabetes, and also there is risk factor of diabetes in these family history, hyperlipidemia, hypertension, and delayed presentation of MI. Therefore, the correct answer is beta, which is the pre-diabetes. MCQ 3. A 45 years old male presented in the outpatient department with symptoms of tingling and numbness in the feet, leg cramps, weight gain, extreme thirst, increased hunger, dry mouth, frequent urination from the last 2 years. He reported positive family history of diabetes. He recently showed reports of fasting glucose to 30 milligram per deciliter most days and HbA1c 8%. A most likely cause of these symptoms is due to gestational diabetes, pre-diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes.
E.
Yes, correct answer is E, because as the age is more than 30, 45 years male, and in type 2 diabetes there is tingling and numbness in the feet, leg cramps, and it is slow onset and presented in less than 2 years, and therefore type 2 diabetes slow onset. And he also reported a positive family history of diabetes. Therefore, correct answer is type 2 diabetes. MCQ score. A 40-year male presented in medical outpatient department with symptoms of increased thirst, urination, fatigue, and blood gain for last 6 months. On clinical examination, his BP is 140/85, BMI is 36 kg, waistline is 40 inches. His clinical lab assessment showed triglyceride 160 milligram per deciliter. Fasting blood glucose sugar is 155. A high density lipoprotein is less than 30. The most likely cause of this sign and symptom is due to Addison disease, Cushing syndrome, metabolic syndrome, Braggart's disease, or thyroid disease.
C.
The
E.
correct answer is metabolic syndrome, as all three symptoms are high blood pressure level, and, and the increased thirst and urine is due to diabetes, and fasting blood glucose level, HDL level is less. All these are the signs and symptoms of metabolic syndrome. Therefore, the most common symptom due to metabolic syndrome, C is correct answer. MCQs 5. A 25 years female 28 weeks pregnant presented in gynecology and obstetric outpatient department with symptoms of increased thirst, fatigue, and increased urination for last 1 month. She gave positive family history of diabetes. The most likely cause of these symptoms is due to gestational diabetes, pre-diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes.
A.
A.
Alpha is correct answer because as a female is pregnant and in pregnancy diabetes is known as gestational diabetes. Therefore, correct answer is alpha. MCQ 6. A 64 years old female present to diabetic clinic to manage type 2 diabetes mellitus diagnosed 15 years ago. She was recently diagnosed with diabetic gastroparesis. The long-term complication of diabetes mellitus in her will be alpha fungal infection of nose, B fungal infection of throat, urinary tract infection, skin and soft tissue infection, or visual impairment.
E.
Yes, E is correct answer. And visual impairment, because in visual impairment, there is the and and in visual impairment it is actually eye effect is diagnosed after 15 to 20 years, and the long term it come in long term effect of diabetes, which is macrovascular microvascular effect. MCQ 7. A group of public health students performed evaluation research on performance of two commonly used diabetes screening tests among 2057 participants older than 40 years of age. According to results, sensitivity of the one test was 40% and other was 80%. What type of screening test shows low sensitivity in this research? Blood urea, fasting blood glucose level, glycated hemoglobin, lipid profile, or urine examination. E is correct
D.
answer. Urine examination. In urine examination, it has low sensitivity and mostly 10 to 50% and varying. Therefore, it is not usually recommended in evaluation research. MCQs 8. A 50 years old male has had type 2 diabetes mellitus for past 5 years. His glycated hemoglobin is 7.5 and he was on oral anti-diabetic drugs daily. He is otherwise well and there is increase in his body weight. He gave a history of smoking and sedentary life. Which of the following would be best next treatment option for him? Change oral antidiabetic drugs, increase the calories from carbohydrate up to 70%, increase the calories from fat up to 50%, increase the calories from protein up to 30%, regular exercise or stop smoking.
E.
E.
He is correct answer because there is no change of oral anti because his hypoglycemic control is good, and he is otherwise well. There is no change in her blood test, and therefore only thing is that he should do regular exercise and stop smoking. MCQs 9. Mr. Ali wants to conduct population-based study to determine the prevalence of diabetes mellitus of type 2 in ABC population. Which screening test is recommended as the best for epidemiological surveys? Blood urea, glycated hemoglobin, lipid profile, 2R value after 75 gram oral glucose test, or urine examination. Delta is
D.
correct answer. Blood examination and mostly 2R value after 75 grams is mostly used recommended in epidemiological surveys for screening test. Delta is correct answer. MCQs 10. Mr. Ali, a 55 years old male, has had diabetes mellitus for past 10 years. His glycated hemoglobin is 8% and he is on oral diabetic medication. Upon his recent routine checkup in the endocrinology clinic, the physician advised him to exercise, maintain his weight, foot care, and regularly walk. Which of the following type of diabetes in which primary prevention has limited scope? Gestational diabetes, malnutrition-induced diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes.
D.
The delta is correct answer because yes, in the primary prevention and level of prevention, it is mostly for type 2 diabetes, and it is no and in type 1 diabetes, the primary prevention has mostly the limited scope because of risk factor lifestyle modification, which plays a most important role in type 2 diabetes. Therefore, there is limited scope in type 1 diabetes for primary prevention, and the correct answer is delta. The key of the MCQs.
Assalamu alaikum.
Thank you.
Very nice, Dr. Hansa. A very good presentation as you have told about different important things, especially the screening program. And we know that in next 20 years, almost diabetes mellitus in the world would double. And that is something that is very alarming. And one of the most important thing is that the lifestyle modifications are most helpful in controlling this epidemic of diabetes. Even in Pakistan, if you have seen the latest statistics of WHO, it has shown that the increase in diabetes in Pakistan too. So the most important part that I would like you to add in your presentation is about the latest figures that has been released in 2021, this in on November 2021, about the prevalence of diabetes mellitus that has shown increase in different parts of the world, including Pakistan. And that is something that the public health programs should target. Another important thing is, as we know, that the uncontrolled diabetes has many complications. So the screening of all the diabetes, especially type 2 diabetes, is strongly recommended. We don't recommend the screening for the type 1 diabetes because it has a very different etiology and the lifestyle modifications are quite different. However, all those people who are above 40 years old, and according to the Diabetes Association of America, they have extended the age to 45 years. They should go for the screening program. According to other guidelines, all those people who have the risk factors like obesity or having the family history of diabetes, they must go for the screening of diabetes mellitus type 2 after 40 years of their life. However, we know that the lifestyle and pharmacological interventions have decreased the progression of complication of diabetes, and the screening greatly helps in early identification and early use of all those lifestyle modifications. Even the pharmacological therapies, they have shown a great revolution over the years, and we know that there are many important drugs that have been included in the recent guidelines and by the Diabetes Association, and the US Preventive Services Task Force has recommended many things for pre-diabetics. That is the reversible condition. We also know that the lifestyle modifications and the pharmacological interventions have decreased the progression of diabetes